Hello, everybody. Welcome back to As We Speak. Now, in light of World No Tobacco Day this week, I am so happy to be discussing something that is plaguing our teens worldwide, and that is the epidemic we call vaping. And I'm so happy to have here with me Dr. Iyaad Hasan, a certified tobacco treatment specialist at the Cleveland Clinic in Abu Dhabi, here in the UAE. Welcome to the show, Dr. Iyaad. How are you?
I'm doing great. Thank you for having me.
So, Dr. Iyaad, you've been recognized for your efforts with smoking and tobacco control at the Cleveland Clinic main campus in Ohio, in the United States of America. Am I correct?
Yes.
And you developed that treatment center and you headed it.
Yeah, it was great. It was 14 years ago since I really got it. I've always been in family practice, but tobacco cessation has been one of those things that really is a huge behavioral change, because quitting smoking is a tough thing. It's behavioral, but as well as physical. So we've really medicalized it. In Cleveland Clinic, the main campus, especially as we're trying to push and change here in the UAE with tobacco, Cleveland Clinic Abu Dhabi, Cleveland Clinic main campus, we resend, and technically we don't hire smokers. If you don't pass your nicotine test, we take a strong stance on tobacco, very strong.
Right. So you're the perfect person. You've been doing this for 14 years. You're like the perfect person for me to talk to. So, doctor, let's get right down to it. Many parents are okay with their teens vaping. They do not equate it to smoking. They think it's less harmful. They don't think it's as addictive. Why do you think that is? And what are your views on this?
Well, I will say this, because the number one questions that's going to come out, is it less harmful? Is it something that we really should start allowing and everything? And I have to admit to you, vaping in itself is a tough topic, or e-cigarettes, because when they first hit the market years ago, they were just something that was just seen as brand new. And it really, the marketing of them has really changed and has hit the younger generations. They've really, really marketed. Now, don't get me wrong. The tobacco industry is very clear that they focus on teenagers in general, of getting them to start smoking, and then they can become a smoker at the legal age of either 18 or 21, depending on where you're at. So the hard thing about vaping is it's dubbed as a new topic or a new twist. In my eyes, many times I dub it as the new Diet Coke, where many people will have the Big Macs and they'll have the actual value meals, but they'll get a Diet Coke. Why? Because at least I save some calories in that, and it doesn't have the sugar in it. With that being said, that's what's here that's presented to us, is we have something that supposedly is cleaner. And the respects is that it doesn't have 4,000 chemicals that exist in a cigarette. It may have 400, 500, or 1,000 chemicals. And so since it's less chemicals, it should be dubbed as a healthier option. Now, idealistically, it is. But last, when I would talk to anybody, putting any chemical in you is wrong in general. So ultimately, my big stance is, yes, we do need to do a lot of research on this. But at the same time, if we look at the general stance of it, it still is the same. Smoking is vaping and vaping is smoking. You can't technically separate them out, because their main focus is to build an addiction, to get them hooked, and to keep having them come back over and over and over again.
Doctor, can you explain the new vaping-induced lung disease the CDC identified? The CDC is the Center for Disease and Control in the United States of America. They identified this in 2019, just before the pandemic hit. And I think it's called EVALI, or popcorn lungs. Could you elaborate? What does EVALI stand for?
EVALI was created in 2019 after the huge international scares, and specifically as pushed in the United States, of youth dying or becoming severely sick from it. If we look at EVALI, EVALI is e-cigarette and vaping products, okay? Associated lung injury, or EVALI for short.
Okay.
And basically what it is, it's a severe lung disease that really affects an individual. And what it does is it sometimes gives them a fever, a severe cough. severe heart palpitations, fast heart rate, heart breathing, and the main thing that we really see is shortness of breath. Now, we're seeing this a lot more and more in teens, especially individuals, because they're really utilizing it as similar to a cigarette. They're utilizing it as a coping mechanism or as a way to actually unwind because they feel that they're taking in the actual vaping or the actual vape or the mist into their lungs. Now, how do we treat it? Sadly, some of them develop severe pneumonia and we have to give them strong antibiotics. Some of them are similar to like asthmatics where the lungs are so tough. We have to give them like steroids to loosen up the swelling in the lungs so they can breathe better. Now, is it really a long-term thing? Some people have had permanent damage. Some people have been cured, but similar to sadly to the epidemic that we have right now with COVID, and many people still have long-term effects. So EVALI has really taken on a concept that I think a lot of parents need to focus on. Vaping is not actually something that's healthy or something that's nice for your kids to do. They're changing the flavors, and children really love the either the tutti frutti or the strawberry flavors or the bubblegum flavors because they feel that it's like something that's clean and it's cool to do. So in the end, EVALI is becoming an emerging topic that I believe most clinicians are really trying to tackle, especially with our younger population.
Right. So what you're saying is vaping can effectively kill a young teenager. Am I correct?
Yes, if it gets to the point where the lungs have become, and let's even if it isn't vaping, let's, for any parent out there, if you damage the lung far enough where air can't get in, at one point or another, the oxygen levels drop to the point that the individual can die. It's pretty straightforward.
So you've explained what EVALI is. Now, can we put this together with, say, a vaping teen who has been diagnosed with COVID-19? What happens?
Yeah. We just need to make sure that the parents take an understanding. Now, the one specific fact which parents should know is there was a research study that came out not too far long ago, and it was actually endorsed with many of the government, especially in the United States, that showed that individuals who vape have a 7 times more likely chance to catch COVID.
Wow.
Which again, if you think of it, it makes sense, right? We're putting strong irritants in the lung. My immune system's overwhelmed, trying to heal up as much as it could. Introduce now an overwhelmed system, an overwhelmed immune system with now COVID into your system, and bam, you have something ready to explode. So in the end, sadly, as I said, we get severe shortness of breath, fast heart sounds, fast breathing, okay, shortness of breath, as well as a bad cough, sometimes even a fever with this type of disease. And so individuals who have those symptoms, we usually tell the parents, it's again, we have to treat your son or daughter. And it's usually, as I said before, it usually involves steroids or possible antibiotics. Now, throw in COVID. If you listen to those symptoms, they literally almost mirror each other because individuals usually spike a fever, severe cough sometimes, shortness of breath, okay, sometimes a little bit of tachycardia. Haven't seen it firsthand. It's a sad disease to have. And we need to take it seriously as it is, whether it's COVID or not, right? Now, as a parent in general, you just knowing those general symptoms, if they are in this pandemic times, I would recommend to get a COVID test immediately. But if the COVID's negative and this individual does especially spike a fever, they need to be assessed by a pulmonologist or your family doctor or internal medicine doctors to actually understand what's going on. Most times we'll do a chest x-ray, as we discussed in the beginning. Sometimes we'll see some types of changes in the lungs and we'll be able to do it. We may be even to diagnose a pneumonia or an infection in the lung itself. But again, we just need to make sure that the parents take an understanding. Striking, sadly, the main point which I want to strike with all parents, especially if they have that fever, that's a bad sign. They need to get in right away. A definite assessment needs to be done.
Right. Thank you so much. I think so many people don't know this, and it's so important that they do. So thanks so much for doing that, for telling me.
Stay tuned for part 2 of my dialogue with Dr. Iyaad Hasan at Cleveland Clinic, Abu Dhabi, where we discuss the physical and mental effects of vaping on our young adolescents, what it really takes to become addicted, as well as tips and advice for parents who are navigating this new cultural norm with the younger generation today. Thanks for watching.